So let me teach you a little about the anatomy of your body. I promise it's going to be interesting and I'll be as simple as possible so you could comprehend it. So let's talk about your thyroid gland. I know you've heard about the thyroid gland and probably you had wondered, what is this thyroid gland? What are the functions? What is the essence? Where is it even located? I know if I ask some people, they know where it is located, but some of you might not know where it's located. So we'll talk about it today. You see, let's begin. The thyroid gland is a very vital gland in your body. It is an endocrine gland. And what does that mean? I promise to be as simple as possible. When I say it is an endocrine gland, it means it is a hormone-producing gland. As simple as ABC. Okay, where is it located? Your thyroid gland is located in front of your neck. Yes, as seen in this picture I drew here. Don't laugh at my pictures. I tried as much as possible to draw something so you could understand what I'm talking about. Look at it in that picture. Your thyroid gland is in front of your neck. It is right below your larynx. Your larynx is also called your voice box. So your larynx is up and your thyroid gland is just right below it. And it has two lobes. If you can see in that picture, the thyroid gland has two lobes. It has a right lobe and the left lobe. And joining these two lobes in the middle, look at it in the picture. In the middle here is a tiny tissue that connects the right lobe and the left lobe of your thyroid gland. And that tissue is called the isthmus. I labeled it, called the isthmus. As you can see from the picture, your right thyroid gland lobe and your left thyroid gland lobe are connected to your trachea. Your trachea is also called your windpipe. They are connected to your trachea on both sides. So, I will stop there for now about the location of your thyroid gland. So, are you interested in knowing the weight of the thyroid gland? Well, from study, the thyroid gland weighs about 20 to 60 grams. So, why is this thyroid gland important? Why is it important? Remember, I mentioned in the beginning that it is a hormone-producing gland. So, what are the hormones that this thyroid gland produces? And what are their uses, their benefits to you as a person? Okay, from study, the thyroid gland is said to produce 3 hormones, T3, T4, and then calcitonin. I'll break it down. If I've ever gone for a thyroid gland, test or examination or something, you probably had heard your doctor or the lab scientist saying something about, increased level of thyroid hormone, increased level of T3, T4, TSH, and all of that. You see, this T3, the 3 there will reflect in the oral name. Don't be bothered by the names I will call, okay? Don't bother about it. Just know T3 and T4. That's all you need to know as a layperson. So the T3 is also called triiodothyronine. The tri is the 3. Iodo, do you know what that means? I'll talk about it later. And then we have the T4. That's called the tetra. Tetra is 4 now, yeah? So tetraiodothyronine. And the last hormone is called calcitonin. You see, if you notice in the triiodothyronine and tetraiodothyronine, there's something. The tri is 3, the tetra is 4, the iodo is present in the 2. So the iodo means iodine. And what does this mean? It means that your thyroid gland needs iodine to be able to function properly. But somehow, we do not produce iodine in our body. You do not produce iodine in your body. So you get your iodine from your diet. And that in essence means that you should eat diets that are rich in iodine. So as you're taking these diets that are rich in iodine, like shrimps, tuna fish, cod fish, some dairy products, milk, yogurt, and all of that, the iodine in this food gets absorbed, gets taken into your bloodstream. And via your bloodstream, they get to your thyroid gland. So when this iodine gets to your thyroid gland, the thyroid gland now makes use of the iodine to produce these hormones that we mentioned, the T3 and the T4 hormones. Clear? I hope you get that. Yes. If you don't get it, just leave the question for me in the comment section. I will answer it. Okay, now, these hormones, what do they really do? What's their function? Let me mention first the calcitonin hormone. The calcitonin hormone is responsible for bone metabolism and calcium metabolism as well. But now we're going to be more focused on the T3 and T4 hormone. Yeah, because it is believed that they are the main hormones that your thyroid produces. You see, these two hormones, they perform the function of increasing your basal metabolic rate. Cumbersome, right? Basal metabolic rate is very simple. That means, in essence, that they help to increase the rate at which energy is produced by your body in order for you to be able to carry out basic functions. Every day, the cells in your body, your system is carrying out basic functions of respiration, excretion, pumping of blood, and all of that, even growth in children. So, these two hormones are responsible for helping to increase the energy that you need to be able to perform these basic functions. They also make your cells, the cells of your body, to work harder, making them to use up more energy, and then that keeps your body in check and in control, and everything goes seamlessly. So, but hey, here lies the problem. There are times that this thyroid gland decides to misbehave, maybe due to one thing or the other, and then the thyroid gland can decide to slow down and chill. And then it grabs a chilled bottle of water with some fruit and relax on the chair and say, today is my relaxing day. Okay, that's on a lighter note. There are times the thyroid gland might become underactive. When they become underactive, what do you think will happen to the hormones that they produce? They'll produce less hormones. They'll produce less of the T3 and the T4 hormones. You should be able to know what will happen. Since this hormone helps to increase the rate at which energy is released for you to carry out basic functions, increasing your basal metabolic rate. That means your basal metabolic rate will be what? Slowed down. And this could be seen in hypothyroidism many times. And then there's another part. The thyroid gland might decide, okay, I want to overwork myself. I'm gingered. I'm on some things that are making me to want to work harder. And then they become overactive. When they become overactive, what do you think will happen to? They will start to produce excess of these hormones. What will happen to the basal metabolic rate? It will spike, increase, and then begin to produce symptoms that are uncomfortable. This can be seen in hyperthyroidism. Yeah, hyper. Like the name implies, hyper. And the other ones, hypo, under. This one, hyper, over. Let's talk about some of the symptoms you could notice when the thyroid gland decides to be overactive or underactive. When the thyroid gland decides to be underactive, as seen in hypothyroidism, basal metabolic rate reduces, and then you begin to have lower temperature. Instead of your temperature to be normal, you begin to have lower temperature. Number 2, you begin to feel colder than usual. You are sensitive to cold. Everybody is saying, this weather is hot, like this weather is hot presently. This weather is hot, and you're like, it's cold. I need a sweater. Go and check your thyroid function. Number 3, you could begin to experience constipation. You know why? Because these hormones help to regulate your metabolism, improves your bowel movement, maintain it. And before you know it, when the hormones are produced in lower amounts, your bowel movement will reduce, constipation will set in. Number 4, the heart rate might drop, pulse might drop, because there's a slowdown in the production of these hormones. In women, they might experience heavy menstrual bleedings, and then you could begin to have dry skin, or even dry and coarse hair. And then in the case where the thyroid gland decides to be overactive, you will now have increase in basal metabolic rate. And then you begin to feel hotter than usual. You become sensitive to heat. Everybody's saying, this weather is chill though. It's cold though. And you're like, it's hot. Can I get a fan? More fan, more AC. You are hotter than usual. And then your bowel movement changes. You can begin to visit the toilet more than usual because increased metabolism. What more? Like you could have faster heart rate. Your heart, you could have palpitations. Your heart keeps pounding, beep, 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 as if it's going to jump out of your chest. And in this case, your skin can become warmer than usual, and moist. The hair can become fine and even or brittle and all of that. There are menstrual changes are noticed too. And you could begin to notice unintentional weight loss. You are not trying to lose weight, but you are losing weight. And in the case of underactivity, you are gaining weight. You notice increased weight gain. So, in all, I would say, because I'm about to round off, take care of your thyroid health. And how do you do that? Although you might not be able to prevent some thyroid disorders from the food you eat or from your activities, but in a case you already even have a thyroid disorder, eating some of this food or carrying out some of these activities could help to relieve or reduce the symptoms of the thyroid disorder. So, here are ways to maintain a good thyroid function. Number one, you should guess what I'm about to say. Eat a lot of food that are rich in iodine. Iodine-rich foods like your shrimps, tuna fish, codfish, dairy, yogurt, eggs, nuts. Yeah, they could help with thyroid function. Number two, get active. Avoid the sedentary lifestyle. Yeah, that helps with your thyroid function too. Number three, limit or avoid stress. Yes, stress from studies have been shown to trigger thyroid disorders, especially autoimmune thyroid disorders like Graves' disease, Hashimoto thyroiditis, and all of that. Stress. So limit or avoid stress as much as possible. Number four, try to rest and get a good sleep, and that could help you to also avoid stress. All this stressing of our body, not getting enough sleep, often trigger diseases that we are not expecting. And then, lastly for this video, I would say if you have family history of thyroid disorder, if anybody in your family, your parent, your sibling, your sister, or a few people in your family had thyroid disorder, especially the autoimmune type, then speak to your doctors early about this so they could guide you and help you as to how to probably manage it or reduce the symptoms or the worsening of the disorder. In all, if you notice some of the symptoms I've mentioned above, you are getting too cold, or when everybody is saying it is hot, or you are getting too hot when it is obviously cold, you are having a rapid heartbeat, a regular heartbeat, palpitation that didn't used to be there, or you are losing weight unintentionally, you are gaining weight unintentionally, and you are constipated, and it's not like you are eating a low fiber food, you are even eating high fiber food, but you are constipated. So, or you are having too much diarrhea. Get out the symptoms. You know what I'm about to say? Visit your doctors. They will guide you appropriately on what to do. There will be proper testings, diagnosis, and medical management. I hope you enjoyed this teaching. So you've learned something about your thyroid gland, right? And you can teach somebody else. Thanks for watching. Till next time. Bye.